Golenhofen. This is the Tinnitus Relief Summit. My name is Dr. Ben Thompson. I'll be your host. We're going to open up the chat, and if you're with us live, I'd love to hear where you're coming from, who you are, your name, where you are right now. I'll put it in the chat first right now. Ben from California. So there's over 100 of us here live, which is excellent. And that means they'll be able to learn from Dr. Golenhofen, who really is one of the world's best, in my opinion, about explaining the root cause of tinnitus to patients. A quick introduction before we get started. I met Dr. Golenhofen a few years ago, and our connection was really focused on what could we do together to help people with tinnitus in the global community who are online looking for answers. So Dr. Golenhofen, for those who don't know, is a distinguished ENT physician and practices at his clinic, which does specialize in tinnitus, in Germany. And throughout his career, Dr. Golenhofen has integrated a modern ENT research approach with a whole body approach as well. So he treats conditions such as tinnitus and sudden hearing loss. He's here today to present and discuss how to find the root cause of tinnitus, an ENT doctor's perspective. Dr. Golenhofen, welcome to the summit.
Thank you very much for having me. I'm glad to be here.
You saw patients today, I imagine, so it's the end of your workday. Any particular tinnitus patients that came through the clinic today?
Actually, today is my day off, and I prepared a lot with my online project. But yes, I saw a couple of them yesterday.
Excellent, excellent. Well, let's jump into it. The main message here, the main question we have is, how do we find the root cause of our tinnitus? So if I'm a tinnitus patient, if I'm someone who has ringing in my ears or just one ear, and I go to my primary doctor, they say, you should see an ENT physician. In your opinion, what should happen at that ENT appointment? How do you handle those cases that come into your clinic? And how do you find the root cause of what's going on?
Yeah. Well, first of all, it's so important that we act correctly in this moment, because our patients are so tense in this moment. Usually, tinnitus is a rather stressful event. And what happens when I have a tinnitus perception, I go and see a doctor, is the same when I have a stomach ache, for example, and I visit a hospital. Why do I go there? Well, I want to know what is happening with me, and I will not leave before I do. And that's why it's so important to see our patients and to quickly let them know we are looking for the cause, and we will let you know. We will explain to you what needs to happen to diagnose it, what needs to happen to treat it. And this takes so much tension out of the system right away, because I feel connected to someone who is really doing a professional job and seeks the disorder behind the symptom. This is step number one, and it's so important because what we want to do is a positive counseling, and this means we explain which disorder is causing the symptom. And I can just encourage everyone to ask for the answer to the question, what is the cause for my tinnitus perception? And this is so important first step.
Excellent. Now, to help those who maybe have already seen an ENT doctor or they are going to see an ENT doctor, any advice for what happens next if the patient says, hey, I want to find the root cause of my tinnitus? What should happen next, in your opinion? What are the next appropriate tests or procedures to understand, is this an ear condition? Is this a brain condition? Is it something else?
Yeah, it is always in some ways complex. Tinnitus disorders are not easy to treat and not easy to diagnose disorders. That's true, yes. But on the other hand, it's not that difficult as well. As ENT physicians, we do our hearing tests, and we determine, is there some inner ear disorder, some hearing damage, the cause for the tinnitus perception, yes or no? And then there are some major disorders or some major fields of disorder. One is, for example, the psyche and my auditory attention. If I'm very distressed, I start to focus my attention very much on auditory phenomena. And then I can develop some form of tinnitus. Yes, and I need to find out, are you very distressed? How is your sleep? How is your work capacity? How is your quality of life? And then we can also use questionnaires, of course, but this is the second large area that we want to understand when we listen to the symptoms of our patients. And the third has to do with the TMJ, the muscle system, the neck, and so on. And there is one disorder causing tinnitus that usually produces some kind of monolateral tinnitus perception. And when, as a doctor, when I listen to my patient, I can find out pretty quickly what is the cause of the tinnitus perception. And this is what I encourage. I encourage the diagnosis-based approach of tinnitus management for my colleagues, which is about the question, what disorder is causing the tinnitus in my individual patient that is sitting right in front of me?
That's very important. And we've adopted that approach at Treble Health as well. You and I have spoken about this because every audiologist, every ENT doctor can start to think more like it's not just one type of tinnitus. There are different root causes, and that's really what your work in clinical research has highlighted. So, can you discuss the clinical research that you undertook, and what were the results from that research?
I try to link very closely the history and the way our patients describe their tinnitus symptoms to the actual anatomical structure where the tinnitus is generated. And as a matter of fact, our patients tell us a very distinct story about their tinnitus, about the onset characteristics. Has it been a very sudden onset? Did it come gradually? How does the tinnitus really sound? Is it a high-pitched sound? Is it constant? Is it inconstant? Or is it more a hissing sound? And so on, and so on, and so on. And this relates to an anatomical structure in the auditory pathways. And it goes from the inner ear to the hearing nerve, to the brain stem, to the auditory brain. And this is about my research. I try to link those two pieces of information that are important for us as doctors. We want to know where is the disorder happening, where can we treat them. And on the other side, we need to understand our patients, and they tell us the story most often right away.
Hmm. What are the most common subtypes or root causes that you see with your patients coming to your clinic?
Well, I like to see when I speak to my colleagues that we cover 90%, more than 90% of our patients with only 5 disorders. So we don't need to know all 35 or 40 different disorders that usually are very rare. But what we need to know are the big 3 disorders. That's only 3 disorders that cover 80% of our patients in a daily practice. And that's the inner ear disorders, sudden hearing loss, or chronic hearing loss causing through the deafferentiation, through the lack of input to the brain, a tinnitus perception. Second one is the sensory motor disorders, TMJ problems, whiplash traumata in the past, and so on, and so on, and so on. And this is causing usually a monolateral tinnitus perception without any kind of hearing loss. So this is the distinction between those two. And the third is the anxiety disorders, the psychosomatic disorders, where my fear that I have in my central nervous system is actually lowering down the filter system so that I start to hear a bilateral tinnitus sound, which is actually an intrinsic sound, which is always there, but I stop filtering it, and so I hear it consciously. Those 3 are very important, major 3 disorders. And then there is Meniere's disease, a rare vertigo spell producing disorder, and then the medication, the toxicity kind of antibiotics and psychodynamic drug kind of induced tinnitus perception. And with those five, we cover almost everybody.
Excellent. And what's your typical success rate that you find when you use this approach with patients? And maybe we can define success as a significant reduction of the baseline level of tinnitus. What have you found?
I would say over a year, over 12 months or 9 months, it should be around 80%. Okay, so that a patient sits there and says, "Oh, I found relief. I'm okay. I could go back to work. I can enjoy my life." There is still a tinnitus perception very often, very often, but it's not taking over control of my life anymore. And this is what is so important for those patients who are just struggling and experience problems to do their jobs, to earn their money, and so on. This gives a second load of distress very often.
Excellent. I want to discuss a very common case. I find that this is actually a majority of patients who seek tinnitus help. This is someone who has a very slowly progressive hearing loss. They might go get a hearing test and are told you have a high pitch hearing loss or high frequency hearing loss. They may or may not even notice trouble hearing per se, but they do notice a significant tinnitus, either ringing or a hissing sound that is sort of in both ears or in their head. Um, there is often a period of stress, or as you've taught me, the disorder or overwhelm in one's life in the months or weeks leading up to the onset of tinnitus. And then they go see a doctor and they're told you have tinnitus. It's probably because of your hearing loss. But that seems like it's missing the full picture here, that the hearing loss was already there. So why did the tinnitus start and become so loud and bothersome? Have you found that to be a common type of patient? And could you explain what that person should know and what they should do?
Absolutely. That's one of the classical constellations. Very often, maybe the most often found, a combination actually of two subtypes as well. So in clinical reality, it's not about distinguishing only one single subtype. Very often, we find two subtypes together very often in clinical reality. And the one that you described is found so often because the hearing loss was there before the tinnitus kicked in, right? At the same time, it has to do with especially our treatment because we want to prescribe hearing aids whenever there is some kind of hearing damage in a tinnitus patient, simply because the sound enrichment, the fact that we replace the auditory information to the brain through a hearing aid makes a significant reduction of the tinnitus perception. And when I go through my day and I do not have 80% of my tinnitus, I just have 20% or 25%, makes such a difference. I can easily habituate to the sound so much easier when I have less tinnitus perception simply by wearing a hearing aid. But at the same time, we need to address the mental situation of our patients, not just saying it's the hearing loss, we prescribe a hearing aid, that's it. But we need to make them understand that we understand their situation and we want to help when there is distress, when there is a sleep disorder, and so on, and so on, and so on. I love those three steps of comprehensibility. Yes, we want to understand. Of manageability. Yes, we want to know what we can do. But then again, meaningfulness. What does that actually mean for the individual in the individual life situation? How can we help best?
Absolutely. Let's talk about another common case. So this one is probably an underdiagnosed case where someone may have tinnitus actually related to their jaw or their neck. Could you please explain the fundamentals of this type of tinnitus and what we should know about it?
Yeah, it is important to to know that this type of disorder acts completely different and produces a completely different kind of tinnitus. It kicks in very quickly, very suddenly. It is usually not linked to any kind of hearing damage. And it is always very stressful when it has its onset. It it is not possible to just not listen to it. It it is very intrusive. And from that, it very quickly pulls along the other subtype, which comes from my distress. So very often the onset is a monolateral tinnitus perception, which really stresses me out, doesn't let me sleep anymore. And after days, even when this sound is a little less, I start to say, isn't there a second sound? Isn't there something in my head that sounds like a waterfall or so? And this is also a very classical constellation where we need to make this distinction. Um, what kind of sensory motor disorder is actually happening in the teeth area, in the TMJ? You will have another specialist talking today about this very important topic. I really am excited about this program because it covers the most important subtypes of tinnitus, the most important disorders. And it makes such a huge difference when I understand, oh, look here, this is my disorder, that is my disorder. I know what to do, gives me so much relief already.
Absolutely. So what we found is speaking to a doctor like you, speaking to an audiology doctor like me, someone who understands this diagnostic protocol or paradigm, we can provide the clear assessment of, hey, let's identify this is your root cause. Usually it's two together. That's what I've found. And here's what you should do. Forget everything else. Forget all these, advertisements on the internet, the forums,
Absolutely.
the distractions, really, and just really do this and be consistent with it. Um, how much do you follow up with your patients throughout a treatment? Sometimes you're not the one providing the exact, for example, TMJ treatment, I'm sure. So, any advice for patients on the timeline for a treatment, uh, advice on how they can have a successful treatment over time, with the consistency.
Well, the timeline is important because, as I said before, tinnitus disorders are not simple disorders. Usually they're difficult to treat, specifically those in the sensory motor area where TMJ problems, neck problems are an issue. It takes time. It takes time 3 months, 6 months, 9 months. Um, it is important to just relax and say, okay, I take my time to slowly cure those disorders, and I will see success with my tinnitus perception afterwards or during this treatment. Usually, when I see the first osteopath or chiropractor, I already realize the little movements that she or he does with me does change the tinnitus perception. So I am obviously on the target. I'm on my right spot here and I treat the right kind of disorder. But at the same time, yes, they are complex and they combine physical with mental problems at the same time. It does take time. That's why it's so important to have a network at hand where different people can treat. And since I have so many patients from abroad or from other cities in Germany or all over Europe, yes, I let them treat at home and I work together with those therapists, with dentists, with orthopedic doctors, with audiologists, with so many, and we need to do the work on our tinnitus patients together as a team.
I want to use this root cause approach or this protocol, this system to help our everyone who's here. There's over 200 people listening in right now. We have the full schedule for the summit ahead of us, and you brought up a very good point, which is that for anyone who's here, they should start to reflect on, Is my tinnitus related to stress or anxiety that was going on before it started? Is my tinnitus related to a hearing loss? And potentially, do I have any symptoms related to my jaw or my neck? Those are sort of the three main subtypes. So, um, for example, we have certain presentations that are just focused on the stress and anxiety and sleep part of this. We have certain presentations that are focused on brain plasticity, which would be more of that central stress or anxiety piece. We have the TMJ presentation, which is just on the jaw. Um, we also have presentations on bimodal stimulation, as well as tinnitus retraining therapy. So I think taking these three root causes that apply to most patients and having people go through the summit with that question in mind of, does this apply to me? And if so, how? Any advice on that regard in terms of how we should approach the summit and the different speakers, knowing that not every presentation or treatment applies to every single person?
Yeah, of course, this is the fact, but I really like your program. I like this wonderful approach of Julian Cowan Hill with his boat mast meditation. It's such a simple but so effective way of treating. And yes, the sensory motor TMJ problems need to be addressed. And I think, yeah, I love the program. I think you will cover everything, and this is important. But maybe it is most important to communicate, even when you've seen some specialists that you came from with the sentence, there is little we can do, try to do it by yourself or whatever, I can't help. This is not the answer. And this is not the answer we want to give. Uh, Go on searching for the specialist that really helps you, takes your hand and says, okay, we diagnose, we treat, we find the answers for you. And that's why I think it's so important to have this Tinnitus Awareness Week. What do we want to be aware of? Don't we want to be aware of that there is help, and we just need to find the disorder behind this symptom, and then we can provide help.
I'm on board. You have a website, formyear.com, as well as TinnyCare. Could you please share more information about where patients could find you? If they're in Europe, perhaps at your clinic, they could give a call to investigate if that would be a good fit, or some of the digital resources, which are much easier to start. Where can we find you and your great work?
Yeah, my practice is located south of Munich, and there is one website out there, which is formyear.com, but at the same time, tinnitus clinic in one word.de. And there is an English website. I just launched it the other day, which also has a resource which is the tinnitus test. And there you can just punch in your symptoms, and you come out with a analysis of your subtype, which is free, no charge, but which gives you the first information on this very important topic. This is my physician side. And then I just launched, actually this afternoon, our new set of tinnycare.com, tinny-care.com. And this is a platform which provides you with a little booklet almost for free, which covers my approach of diagnosis-based tinnitus management. There will be an online course where I explain for 2 hours each and every subtype in detail and give all the resources for further therapies, for further places to go, and where you can find help with this disorder. And then there is a retreat in Sardinia where I teach my patients in the spring and in the fall. So I hope that will cover most of the important subjects with this platform, tinnycare.com. Thank you for asking.
Excellent. Guys, this is Dr. Michael Golenhofen. Let's give him a virtual round of applause. And next up, we have Julian Cowan Hill, who's starting in just a few minutes. What I'd like to do here is get us set up for a quick review of today's schedule. Um, it's incredible. This is the third year that we're doing this event, the Tinnitus Relief Summit, and this year is by far, in my opinion, the best lineup of speakers. We're really touching on all of the relevant points, all the available treatments for tinnitus. You really don't have to read any other books or watch any other videos. If you watch the videos here in the summit, you'll know pretty much all you need to know about what you should do about tinnitus. So, as you can see, next up we have Julian Cowan Hill discussing body-based therapies to calm the nervous system. And then we have Dr. Diana Vetere discussing solutions for sound sensitivity and hyperacusis, followed by a 1 hour break. And then we have 8 discussions. I'm going to be busy today and talking a lot. We have 8 discussions. I'm excited to introduce you to all these amazing guests. So, covering topics like brain plasticity, the charitable organization, the American Tinnitus Association, bimodal stimulation for tinnitus relief with a very experienced provider. We have one of Dr. Jastreboff's leading mentors, Dr. Jason Leyendecker, discussing tinnitus retraining therapy, and much more. So, very excited for this. We now want to launch a poll. So, we want to get to know you a bit better. If you're here with us, we want to know a little more about your case, who you are, and how we can help. So, I'm going to launch a poll right now, and you'll be able to complete 14 questions in just a few minutes. You should see a pop-up appear on your screen right now, either through your phone or on the computer, the Tinnitus Poll Summit 2025. So please go ahead and answer those questions, and then in just a few minutes, we'll start with our next presenter. Thanks so much. And thank you, Dr. Golenhofen.
Thank you very much for having me, and much success. I will join for tonight's sessions. Thanks, and bye-bye.
Thank you so much. All right, for those who are just with us or who need a reminder, we have another 2 minutes here for you to complete the answers on the tinnitus poll. How bothersome is your tinnitus? How long have you been experiencing it? How does it impact your life on a daily basis? What are you currently using for treatment, et cetera, et cetera? So please take another minute or so to complete that poll, and then we'll get started with our next presenter. All right, there's 15 of you who've participated by completing the poll so far. Let's wait until that number gets up to 25%. It's at 18% now, so we're moving quickly. All right, very good. As we're wrapping up here in the next 30 seconds, Julian, please turn on your video and audio. And then also, Julian, if you'd be able to please record this locally to your computer, record on Zoom, that would be excellent.
Okay. Oh, where does it say that? Record. Okay.
It should be under more and then record. Very good. Perfect. And if you'd like to turn your camera down slightly, like the angle, perfect. Perfect. All right, guys, we're going to end the poll here in a few seconds and then we'll get started. I'm very happy to introduce Julian Cowan Hill, who's coming to us from the UK. Julian is a UK trained psychotherapist and craniosacral therapist who's dedicated over 2 decades to helping individuals manage and overcome tinnitus. Uh, Julian's story is really incredible because he personally experienced really bothersome tinnitus for years. And then he found craniosacral therapy and then other psychotherapy methods to help his own tinnitus, and then he started offering these services to clients as a professional. He's worked with hundreds of clients and he uses a comprehensive holistic approach, including mindfulness, psychotherapy, and different body-based therapies. He's also the creator of the Quietin app, designed to help individuals manage tinnitus through self-awareness and body-based therapies. You can find him at juliancowanhill.co.uk. And I think if there's one thing that he's brought to our community, it's understanding that one of the ways to turn down the ringing is by settling the mind and settling the nervous system of the body. Such a clear message, and it really works. So don't look this over and really consider how you can implement this in your management and treatment plan. Julian today is going to present on body-based therapies for tinnitus, calming the nervous system for relief. Julian, how are you?
I'm very well. Apologies for a slightly husky voice. I've had a cough over the last week. Um, but yeah, maybe just to start off with my own story, I had really bad tinnitus for quite a long time. I had it for 20 years, and the last 4 years it was extremely bad. And in 1999, it got to the stage where I couldn't hear the phone ring. I couldn't sleep. I couldn't really hold down a job because it was deafening. And thank God, a friend of the family came round and said, "Well, why don't you try cranial sacral therapy?" I'd never heard of cranial sacral therapy before. And she said, "Listen, just go. I think it'll help you." And I went along to see this guy. He asked me a few questions, and then I lay down on the couch, and he put his hands around my head, and it's a very light contact. And I had a really strange experience because I felt like there were pressure changes in my head, and I felt myself just relaxing. And then I remember his hands were on just in this very exact position. And after about 10 minutes, I heard my tinnitus change tune, which was really shocking. After 20 years, my tinnitus went through very gradual changes. It gradually got worse and worse and worse. And I went through brass bands, screeching cats, hissing kettles, you name it. But it all changed very slowly. So to be suddenly lying on a couch and have somebody like twiddling a tuner knob on a radio station, suddenly my tinnitus changing was really shocking. And I said, "What are you doing? How are you doing that?" And I felt my body relaxing and kind of dropping into the couch. And I had this very, very powerful reaction. I was very lucky to have a really positive response in the first session. And I remember sitting up feeling slightly woozy. And I got off the couch onto my feet and felt very sort of rooted down into the ground. And I went home and I had to drive so slowly on the way back because I kept on bursting into tears and laughing and felt quite emotional. And my tinnitus it changed gear. So I went back and I saw him again and again, and my tinnitus started to become less intense to my amazement. And then because I wasn't working, I was at a crossroads in my life. I decided to take up a training course, And over the course of a year of body work, my tinnitus went from about a 9 out of 10 all the way down to a 1 or a 2 out of 10. And this really was life-changing for me. And so I can remember one morning after about a year of practice of doing the training, I actually woke up in silence, which was like a miracle for me. I never ever thought that would happen. And so I qualified and I set up a practice working with tinnitus people in 2000, and I've been busy ever since. And when I look back, I just think I'm so lucky and so glad that I found a body-based therapy to get me out of my head into the body, and it helped my nervous system shift from this fight or flight freeze state back into well-being. So I think one of the first things I want to be really clear about, there are many, many triggers for tinnitus and many causes of tinnitus. Dr. Michael Golenhofen was talking about body-based tinnitus, central type of tinnitus. One of the things that I have found routinely with tinnitus people is that we get stuck into this state of being up and out and hypersensitized. So our whole system's functioning like a radar, listening out for danger. And whatever the cause of tinnitus is, once we latch onto it and then react against it, it can trigger more adrenaline. Our sensitivity goes even further through the roof. And before we know it, we're so sensitized, listening out for danger, that we can hear buzzes, pops, crackles, whatever, cardiac pulse from inside the head. And so one of the key things that I offer, and one of the things that helped me more than anything, was to get body-based therapy to help down-regulate my system from this overwhelming state of hypersensitivity, where you're just listening out far too acutely and picking up far too much inside the body. And the body work releases and de-stresses you, so you come out of this fight or flight response and drop down more and more into a state of well-being, where it is completely normal when you're back in a state of well-being for your auditory system to filter out the boring background brain buzz. So this is very important. When we come back into a state of well-being, the body comes into homeostasis, the auditory system comes into balance, and the hypervigilance settles. And it's like the internal sensitivity dial comes right down back to normal. So you're no longer tracking cardiac pulse or brain buzz or overexcited hair cells. That all gets filtered out of your awareness. We're designed to hear sounds in the world out there. We're not designed to hear what's going on inside our head. Normally, all the noises of swallowing or cardiac pulse or nervous impulses, they're really, really quiet and we can barely hear them, and they get filtered out of our awareness. So body-based practices help de-stress the body, they help the nervousness settle, and the hypervigilant, hypersensitive hearing can then start to change gear and down-regulate back towards normal. So cranial sacral therapy, I'm very biased towards it because it helped me more than anything. But I've had many clients over the years who have benefited from acupuncture, shiatsu, which is like finger pressure, reflexology, rolfing, deep tissue massage. There's so many fantastic body-based therapists out there who can help your nervous system de-stress and settle. And there are two massive wins with this. First of all, instead of being over focused on the tinnitus and thinking about it and catastrophizing about it and keeping your brain really locked into it, by shifting the focus into the body, you learn to distract your attention away from the tinnitus and redistribute it more evenly throughout the central nervous system. So distraction is definitely something that's very helpful. And crucially, the second thing is getting your central nervous system, bringing the adrenaline down and going from to and you just get that genuine sense of switching off, settling, releasing. The mind stops racing, the senses stop going bananas, and they start resetting themselves. So that's, distraction and calming the nervous system down are hugely helpful. And I think they're a tried and tested way to getting better. So it's something that I would recommend anybody gets involved with. But there's also one other aspect of body work is that you can go and see a therapist and they can help bring your nervousness down. They can help the body drop into a deep state of calm. A cranial sacral therapist, we can tune in and we can feel the buzzy charge and we can hang out with it for maybe 10 or 15 minutes and gradually feel the whole thing settling down. So body-based therapists are very, very helpful. The other thing that's tremendously helpful is doing body-based practice. So I encourage all my clients to take up yoga, Tai Chi, doing slow movement practice, breathing practices. If you go to a yoga class and you're in a bit of a state, at the beginning, you may be thinking, oh my God, this noise is driving me crazy. Oh, I don't know if I can sit here. It's quite a quiet room. And the tinnitus is kind of dominating your experience. It maybe takes up 80% of your awareness. But as you get into the yoga class and you start changing channel out of listening and thinking into feeling and sensing the body, slowly but surely the awareness shifts and you start to connect more and more with body-based experience and less with the tinnitus. So by the end of the class, you may still have tinnitus there, but it's maybe only occupying 10% of your awareness. And there's maybe 80 or 90% of your awareness that's now fully connected to a relaxed, comfortable body that's just plonked on the floor at the end of the class. And you've done some scanning, you've felt through the body, and you're much, much more connected to the body than you are to the tinnitus. So think of this bubble of awareness can shift very dramatic from a hyper focus here onto a much more evenly distributed awareness that goes all the way through the body from head to foot. So this is actually very, very helpful. And it's one of the things that we all need to do. I mean, I say rather jokingly, the way out of tinnitus is this way, out of the head into a calm, relaxed body. And the more you can drop down into a calm, relaxed body, the more the adrenaline levels come down, the more space you get away from this. Instead of being locked in this small pond of intense experiences, you're now connected to a much bigger space of experience. And the tinnitus relatively seems much more like a small fish in a big pond, if that makes sense. So doing Tai Chi, doing yoga, very simple things like in your house, slowing down and moving very, very slowly if you're walking about your kitchen very, very slowly, the first thing that happens is that you drop down and you feel the shape of your body and you connect with the feet on the floor. You start to connect with the lower half. Instead of being hyper focused here, simply moving slowly increases mindfulness of the body, which helps ground you, and that helps bring the adrenaline down, and it gives you a very real alternative to focus on. And if you're having a really bad day, um, you know, we know what it's like when the tinnitus, when we go through a spike and it's driving us crazy, you're going to need quite strong body input to distract you. So that's when you have a cold shower or you go for a cold swim. If you turn the cold shower on, I mean, you don't want to shock yourself, but start off cool and then ease down into cold water, but not freezing cold. If you're standing there, um, the cold water is going to dominate your experience, and your body is going to go through quite a drastic change as it adapts to the cold water. And tinnitus will literally be knocked off its pedestal, maybe down a peg or two or three, because the cold water will take over. And after a period of time, the cold water actually triggers a de-stressing response in the body. It's very, very grounding, and it's actually very calming. You can probably remember going for swims in the sea in the summer, but the water's quite cold. It's slightly when you get in, but after 4 or 5 minutes, you can feel very alive and tingly, and actually gives you a sense of well-being. So, that doing the body-based things literally help take you out of your head, and they calm your nervous system down, and that starts to bring about change. Your nervous system can change quite dramatically. So I just want to point to the app. I have an app called, where is it? Quieten. I didn't know in America Quieten wasn't a word. In England, we say quieten down. Um, but if you look up Quieten, and on the home page, you scroll down to first things first. On this section, you'll find the boat mast meditation. I was happy to hear Michael referring to this practice. The boat mast meditation is something that I teach on the tinnitus healing retreat in Sardinia. I work with Michael and Paola Tedde. She's a brilliant sound therapist and cranial sacral therapist. And every day we practice a way of focusing on the body that puts you in touch with your midline, with your spine. It's very easy to do. You're twisting the upper body, central body, lower body, and then you're moving backwards and forwards like a boat mast on the water. And this does two things. It centers you instead of up and out, danger, danger, radar like ears that tinnitus people tend to have. It brings you in and down, and it helps you anchor your attention. It's very easy to do, and the simple movement from side to side or backwards and forwards helps you sustain your attention in your center. And the more this happens, the more your central nervous system feels safe. There can't be a shark or a lion out there because we're not tracking stuff out there anymore. When we get involved with the details inside the body, that's as if the danger's over and the body can settle. You get your bearings very, very strongly and deliberately inside you, which is very safe for the nervous system. So this can bring down the adrenaline level. So that's one thing that I really recommend strongly. And the other one is massaging the face and yawning, which is another practice that we do on the retreat every day. Doing it every day for a week really cements these practices in. So basically getting your face and jaw and behind the ears and the base of the neck to relax and open up as much as possible. The more relaxed your face and jaw is, the more your ears relax. They're directly connected to all these structures. And this practice is very calming, it's very enjoyable. And at the same time, you're yawning. Did you know that yawning is one of the best ways of de-stressing your ear, nose, and throat system? You get tears appearing in your eyes, your ears pop open, you increase blood circulation, you actually increase cerebral spinal fluid flow, and the physical structures open and relax. The tensor tympani muscle against the eardrum and the stapedius muscle against the cochlea, they actually flutter and create that purring sound when you yawn. It's literally de-stressing your ears. And so with these practices, you can center yourself and you can de-stress the ears, the hearing system directly and immediately. And these body-based practices and approaches directly bring the activation levels down. This is definitely something that we can do, we can get help with, and it shifts the nervous system. It just changes it. And then once you know that things can start settling and becoming less intense, and the sound can start quietening down, then you think, oh my goodness, there really is a way out of this. It really can get a lot better.
Julian, thank you so much. We have a few questions here. The first is from Paula. Paula asks, if I hear tinnitus in my head, can body-based therapy or CBT therapy sessions help?
Body-based therapy will shift the focus out of your head. The hypersensitivity that keeps tinnitus going, if you like, that can settle and shift. So if you're having a reflexology session, having your foot massaged for an hour, it really draws the attention down to the other end of the body. They can access the central nervous system through your feet, and it can influence your tinnitus. It can influence your hearing. Cognitive behavioral therapy is good for resetting the thought processes and looking at your relationship with tinnitus. So creating a more positive mindset. So I wrote a book, Tinnitus from Tyrant to Friend. Instead of seeing it as a monster that takes over and just dominate, once you learn what makes it better and worse, you start to treat it like a healthometer, and it becomes much less scary and much less threatening. And the mindset becomes positive, and you start understanding how the symptom works, and you start to see a pathway forward emerge.
Excellent. And we have a question from Halbert and then also Rose, pretty similar question. So you shared that your tinnitus was a 9 and then you brought it down to a 1. Has that sort of wavered over time, or any advice for people on what happens once it gets better, maintenance, things like that?
Yeah, well, my tinnitus got down to a 1 in the year 2000, 2001. Then I dealt with a dietary issue in my body. I had candida. I had fungal infections from having had antibiotics too much. So I went on a strict candida diet, and my tinnitus went to 0. So from 2002 onwards, I've had largely a tinnitus-free life. To maintain that state, if my tinnitus came back because I went to a loud concert, or if I ate too much salt, or I got really exhausted, overwhelmed, or angry, or something caused a flare up, I would just go straight back to my cranial sacral therapist who could really help my system settle. And I would do um, like an hour of practice. When I got tinnitus again after a vaccination 4 years ago, and it came back, and I had really bad hyperacusis. And I would do 1.5 hours a day of practice. So that would be breathing practices, yoga, Tai Chi, the sack of potatoes technique, which is rolling slowly from side to side. That's on my app. It's one of my favorites. And I had regular cranial work to bring me back down. It took me about 3 months to get back to silence.
All right, Julian, I'm including your website link, juliancowanhill.co.uk, in the chat, and I yeah encourage folks to check out one of your books or download the Quietin app. And you gave us the important step of, Julian, that's a lot of great information, but what can I do today? You said it, so if you didn't catch it on the rewind because Julian laid out two exercises. Do you want to just remind us what are those two exercises and where can we
Yeah,
find you?
the boat mask meditation. If you go into the Quieten app, you'll find it. The boat mask meditation. I go into a lot of detail there, and the yawning and face massage. And just to say, Michael and I are doing this retreat in Sardinia. We do it in May and October every year. So if you want to have an intensive amount of help and practice, all your questions answered, do please contact us and come along. And interestingly, for Spanish speakers, I'm doing a retreat in Barcelona in Spanish. That's going to be in April as well. So if you're a Spanish speaker, please email me and I'll send you the details.
Excellent. Well, let's give a virtual round of applause and show our gratitude for Julian Cowan-Hill, our friend from the UK. Thank you so much, Julian.
Thank you
And
so much for inviting me.
if you want to hang out for a few minutes and answer some questions in the chat, you're welcome to.
Thank you.
All right, everyone. This is the Tinnitus Relief Summit. I'm your host, Dr. Ben Thompson, and I'm so glad that you're here with us. We have an excellent schedule of guest speakers. I've personally invited everyone here, and I can assure you that they are of the highest quality. Hold on hold on one moment. Sorry. Julian, could you turn off your microphone? Thank you. Okay, we're good. Just a quick plug that this event is sponsored by Treble Health. So, Treble Health is not only, you might know us for our YouTube channel or our podcast, but we've actually helped over 2,000 patients through a comprehensive tinnitus treatment program. We have a team of 8 doctors of audiology who specialize in tinnitus, and we provide the coaching, counseling support, as well as some medical devices that are quite effective. The core program that we have is called the Tinnitus 180 program. And you can see that it's a telehealth program that provides the sound therapy devices on the ears or hearing aids for patients. In addition, we provide ongoing one-on-one coaching and counseling support that's addressing the tinnitus, anxiety, stress loop that affects many patients. We know that the things that we're trying to solve for are focusing on being able to concentrate and relax in quiet environments with the sound of tinnitus, doing normal things like reading a book on, in your living room. Those are all very important. And also getting good sleep, falling asleep with tinnitus, getting back to sleep once you've woken up in the middle of the night. So these are all the things that we could help patients with. And if you're someone who wants to speak with a professional who wants more personalized advice on their specific case, then we are offering to you here at the summit a free consultation with a specialist on our team. So you can meet with us for about 15 or 20 minutes over Zoom, and we'll be able to give you some direction on where you should go with your specific tinnitus case. Whether you've already spoken with other doctors or you're relatively new to this, I would advise you to consider this free consultation with Treble Health. We're going to include a link as well in the chat, so you can go ahead and schedule that. You can go to treblehealth.com. You can scan the QR code on the screen right now, and then finally, we'll include the link where you can click that in the chat and then be able to schedule that yourself. So here's the link coming in the chat right now. go ahead and schedule your consultation if you'd like. Now I'd like to move forward with the next presentation here. And next up, we have Dr. Diana Vetere. So let's bring Dr. Diana up to the stage, and then we'll get started on an excellent presentation regarding sound sensitivity, which affects about 30% of tinnitus patients. So excited to start this presentation right here. As Dr. Vetere is getting set up, if you could, Dr. Vetere, if you could please record this on your local computer from your side, that would be excellent. And then I will start here with an introduction. All right, guys, this is Dr. Diana Vetere, and I'm excited to introduce her as our next guest speaker for the Tinnitus Summit. She's an audiologist that has been working on our team at Treble Health since 2024, and previously she was one of the most prominent tinnitus and sound sensitivity specialists in New York in the United States. She specializes in conditions like hyperacusis, tinnitus, and misophonia, which you'll learn about today. She earned her Doctor of Audiology degree from Northwestern University and received specialized training in tinnitus retraining therapy under Dr. Jastreboff, who's a very prominent researcher in our field over the last decades. Throughout her career, Dr. Vetere has worked in both hospital and private practice settings, including Cornell Medicine in New York City, and she's board certified in tinnitus management by the American Board of Audiology. You can work with her and find out more information at treblehealth.com. And today she'll present on solutions for sound sensitivity and hyperacusis. Dr. Diana, how are you?
I'm doing very well today. Thank you for having me. I'm excited to be here.
Excellent. Well, let's start off with a quick introduction. What is sound sensitivity? And for those who are here, they either have tinnitus or they have sound sensitivity, or maybe both. Could you give us a quick introduction to what we're going to talk about today?
Yeah, so we're going to talk about sound sensitivity with a focus on hyperacusis. And hyperacusis is a form of sound intolerance, a sound intolerance where sounds are perceived as abnormally loud. So sounds that other people may perceive as being normal, fairly innocuous sounds, to a person with sound sensitivity or hyperacusis, it actually sounds at a much higher intensity, and therefore it can be extremely uncomfortable. It can even cause pain or varying forms of discomfort. Now, there is another form of sound sensitivity, which we will chat about, and that's misophonia, what you mentioned earlier. Misophonia is a bit different in the sense that it is an adverse reaction to certain patterns of sounds, meaning that certain patterns evoke a very strong emotional response. So there are two different types of sound sensitivity. Our primary focus will be hyperacusis, but we will also touch on misophonia.
Excellent. So in the past week, how many patients have you seen who have a significant sound sensitivity issue?
In the past week alone, I've seen I would say about 3 to 4 patients who have had hyperacusis, either as a coexisting condition to tinnitus or in isolation.
And what kind of problems were they experiencing? What are their symptoms?
So it ranges. There are different forms of hyperacusis. So there could be loudness hyperacusis, fear hyperacusis, pain hyperacusis, and annoyance hyperacusis. But I would say that the symptoms that usually present are varying forms of discomfort in response to, like I said earlier, kind of normal everyday sounds. For some, it actually manifests as pain. So they may experience tingling, dullness, aching, even different types of referral pain to different parts of their face in response to being in social situations or different intensities of noise. The symptoms can also present as avoidance of sounds. So oftentimes people who experience sound sensitivity may start to say, I'm starting to avoid going to certain places like the grocery store or out to eat with my friends because I know that it can actually be very triggering for me, and I'm really not able to get through that situation easily. It can also induce different types of anxiety and stress responses within the body. So it's another symptom. When somebody experiences a sound, they may say, I start to feel my heart racing, I start to sweat, or some type of fight or flight response that puts them on edge, and therefore they cannot be in that situation.
So when patients reach you, they're experiencing a significant degree of hyperacusis enough to actually, start a program for it. For people who maybe have just the early symptoms, or they're not exactly sure what they're hearing or why they are sensitive to sounds, what advice would you have for them as they're trying to figure out, do I have hyperacusis and is it bad enough to do anything about it?
Sure. One of the most important parts of being able to diagnose hyperacusis or to being able to work with somebody who suspects hyperacusis is having an audiologic evaluation to look at all of the different parts of the ear, make sure that everything is functioning properly. To determine, there is a certain test that can be done called an uncomfortable listening level test. And that's really to ascertain at what threshold, at what decibel level that person is perceiving sounds to be uncomfortably loud. In a typical ear, we would expect those levels to be anywhere from 90 to 100 decibels. So oftentimes somebody with hyperacusis may present with UCLs below 90. I've seen it as low as 40. So that's a really important part of the diagnostic criteria. Um, and really just looking at overall function, overall quality of life. How is this impacting this person in their social life, their professional life? Are they avoiding different sounds? Are they actually experiencing pain? And to kind of piggyback off of that, it's also really important to look at other types of, possible anatomical triggers like TMJ, or if there's any muscle tension, anything that could also be contributory to an increased sensation or transmission of sound that could be causing this hypersensitivity.
Hmm. Yeah, one of my favorite stories with sound sensitivity was a patient who, when I first started working with her, she had a severe case of it. Even the relatively soft sound of her air conditioner was too much for her to listen to. And that was a real problem because she lived in San Diego and she had to be there for the summer. Fast forward 12 months after a treatment at a follow-up session, she casually explained how that she was riding on the back of a motorcycle and wasn't bothered. And I said, Loretta, hold on. That means you're better. You're cured. You don't have hyperacusis anymore. If you're not bothered on a motorcycle, then everything is fixed. I think these kind of messages need to be shared because it's such a slow, gradual process to treat it. But if we compare before and after, it's certainly a lot better, if not nearly completely gone. So I'm curious, what is possible that you've seen in terms of treatment with hyperacusis?
Ben, I have to tell you, I actually just ended a session with a patient about 20 minutes ago who, when she first came to me, she was avoiding all situations. She was wearing earplugs all day, every day, in avoidance of sound because sounds were causing pain in her ears. And she started our program. She started with sound therapy. We worked on her stress response, which was a really big factor. And really, I think fear was playing into it as well. So we worked on her stress response. We worked on kind of recalibrating some of her anticipatory thinking, which is a really big part of hyperacusis. There's a lot of hypervigilance that comes along with hyperacusis and by that I mean kind of monitoring the environment just out of protection for oneself. So we worked a lot on her stress response through different techniques, deep breathing exercises, meditations, kind of using neutral language around her, how she's narrating her experience. The sound therapy was a really integral part of it. And when she and I ended our session a few minutes ago, she had just been to a Frank Sinatra concert, and said her words were, I feel like I'm back to my old self. I don't even think about my hyperacusis anymore. And, it's always so great to see that. We see it on our end a lot, but sometimes when you're the patient and you're in it, it's hard to know when that turning point is going to happen. And to her, we spoke so much about this, but she did such great work, and it really is possible to overcome hyperacusis.
Wow. So she went to a Frank Sinatra cover band or
Cover
something of
band,
that
yep.
sort. Okay.
Yeah.
And she was able to be there without earplugs. That's big. That's big. So there's a lot of people here. I think that most people here don't have a very bad hyperacusis problem. Are there any tips you have for sort of protecting our hearing or preventing sound sensitivity issues from getting worse?
That's a great question. I always look at, level of sound. It's really important to make sure that, and sound exposure is cumulative. So if you are someone who works or has worked in a loud environment for many years, you do have to take that into account. Sound exposure or noise exposure isn't limited to always what we think it might be, like concerts or using power tools around the house. Sometimes weddings can be very loud. Indoor fitness classes can be very loud. So really looking at your soundscapes and seeing where you can protect your ears is number one. If you're really curious and you want to figure out what types of sounds you're being exposed to, you can download a sound level meter on your phone. Now, I just want to be clear that that is not a calibrated system. It's going to be an estimate, but it's a really good way of kind of checking in to see what your environment what the sound environment is producing. And so anything at 85 decibels, at a consistent 85 decibels, is where sounds can start to become damaging, but there is a calculation here. So you would have to be in 85 decibels for about 8 hours before it becomes damaging. And every 3 decibels that you increase from there, you can be in that environment for half the amount of time. So I won't go through all those calculations. I'll let you guys do the math. But it's a really good way of just kind of checking in to see, hey, is this damaging or could it potentially be damaging? It's also really good practice to just keep a set of earplugs on you. This way you have them if you need them. So you never know when you're going to come upon some loud sound. If you're somebody who has any pre-existing auditory issues, hearing loss, tinnitus, even pre-existing hyperacusis that you overcame, it's really important to just protect your ears. We don't see noise exposure oftentimes immediately. In some cases, that can happen, but a lot of times the effects of noise exposure are long term. And so, we're not able to see them happening right away. But the effects can be really detrimental. So keeping a set of earplugs on you is really important. If you are curious, like I said, downloading a sound level meter is a good way of checking in. And just being really diligent of managing how much sound is around you.
Yeah. All right. So for those who do have a significant sound sensitivity, um, I've found the most common sounds to be everyday sounds related to um, the kitchen, water, or sometimes people's voices. What do you find are the sounds that are the most likely to be a symptom of hyperacusis sound sensitivity?
I would say some of the same utensils clanking together, doors slamming. It could be air conditioning, any type of like consistent noise. I've also had patients tell me it can be quite troubling for them. And then oftentimes it's being in social situations, not even necessarily at a restaurant, but if you're at a dinner party or you're at a friend's house, there's 4 to 6 people chatting around you. Just the combination of voices can be exacerbating as well. So again, they're really everyday sounds that we would all hear, except or the other is animals or dogs barking. That tends to be a more common trigger as well.
Yeah, and Donna in the chat says the vacuum, peeing in the toilets, a washing machine, those can also be very irritating. I've also
Sure.
heard driving in a car on the highway. So with that in mind, the next step here is, okay, first we've diagnosed a problem. The next question is, what about a treatment? What is a typical course of treatment for someone with hyperacusis?
Yeah, so we like to kind of combine things here at Treble Health. So it's really a combination of, or I should say, the application of sound therapy, which is really important. The thing that you have to remember with hyperacusis, and there are a couple of different working theories out there, but one of the more generally accepted theories of hyperacusis is that there's increased neural synchrony within the auditory system. Now, there are non-auditory factors that do play into hyperacusis, and by that I mean your limbic system involvement, your emotional system does have a role in enhancing or monitoring for the sounds. But sound therapy works to disrupt some of that increased neural synchrony, and it helps to quiet down some of that activity so that sounds are being portrayed in a more normal, natural way. That's number one. Number two is the combination of cognitive behavioral therapy, which, as you know, previous presenters have talked about, really working on recalibrating some of the negative thinking patterns that have formed around this particular condition, and whether that's anticipatory thinking, working on anxious or intrusive thoughts, or even fear-based thoughts, worrying about what sounds might they encounter when they haven't even encountered them yet is really important. Along with that comes working on deep breathing exercises. One of the best pieces of information has always stayed with me. We experience about 400 emotions per day, about 6,000 thoughts per day, and about 20,000 breaths per day. So I always say, what's the highest number there? That being the breath. And let's use that to our advantage. I think deep breathing exercises, we really undervalue the importance of that. And really what's happening is when you deep breathe, you're massaging your vagus nerve. Your vagus nerve runs from your belly right up into your parasympathetic nervous system, which is your rest and relaxation system. So it's really important to tap into some very simple kind of techniques. So again, that kind of falls under the umbrella of cognitive behavioral therapy, decreasing stress response, and then tinnitus retraining therapy, which is a combination more of directive counseling and sound therapy. So we use a combination of everything here.
And for those who are watching on video, I have here a hearing device that's commonly used for hyperacusis sound sensitivity treatment. I thought that I could just put this on my ear to show people what it looks like. It's a lightweight device that sits up and behind the ear like that. There's a thin wire going alongside the skin. And then inside of the ear canal, there's a little rubber tip that has some natural holes in it. So this is very different from a headphone or an AirPod. These are medical devices that have sounds programmed inside of them. And the doctor, in this case, Dr. Diana here at Treble Health, would program specific sound therapies inside of this device. You would wear one on each ear, and you would use it during the course of a treatment. So, Dr. Diana, what should we know about this approach? How common is it to use this? How effective is it?
Yeah, so very common to use this as a form of sound therapy. And I did want to point out, you alluded to it, it's different than a headphone, right? And the reason being is we want to keep the ear as open as possible. There's always a time and a place to use headphones that are more occluding, but when it comes to helping to address sound sensitivity issues, leaving the ear canal as open as possible is what's going to help us achieve that at a much faster rate. And so the effectiveness, in general with hyperacusis, we tend to see somewhere along the same lines as uh, tinnitus, somewhere between the 70 to 80% success rate. I would say probably arguably on the higher side, but it's in general, we see people overcome hyperacusis. And oftentimes when there is when there are the two symptoms presenting together, oftentimes the hyperacusis is what will fade first.
All right. Well, for those who are curious about a formal hyperacusis treatment or using these particular sound therapy devices, I do think this applies to most patients with this condition. So I'm going to include a link where you could schedule a consultation to speak with a member of our team on this. I'll include that in the chat right now. And then also, for those who have some questions, we're now going to spend 5 minutes answering them. The first question here, this has been asked from multiple people, including Stefan and others. What's your general recommendation for earplugs? What kind of earplugs, what brand, and are foam earplugs enough, or how should someone approach that?
That's a great question. I get this question a lot. I think a lot of it has to do with frequency of use, and just making sure that they're properly inserted. What I find with some of the more generic earplugs is that they are not always fitted to your ear the right way. So you might find that they slip out a little bit more, or that the seal is breaking a bit more, and so you're not getting the right amount of protection or what's actually labeled there on the package. If you are looking for something that you know you're absolutely getting a certain decibel, 20 decibels, 25 decibels, you could look into a set of custom earplugs. They're not that expensive, and they could last you for many, many, many years. But the beauty of them is that they are fitted to your ear. So you're also getting the benefit of a really nice seal in your ear canal. So there is a range. There are many brands out there. And so I don't know, Ben, if I'm allowed to mention brands, but certainly I
Yeah, go
think,
for it.
yeah, so some of the more generic earplugs that we've used, Etymotic is a really good set of generic earplugs that you can purchase on Amazon. They come in different filters, and also they come in different sizes, which is nice if you have a smaller ear canal. Even adults who have smaller ear canals can use sometimes pediatric sizes. If you're looking for something that's more custom made, you can go with like a Westone True Custom earplug, or even a Microsonic if it's available in your country. And so again, those are the two brands that I would tend to recommend for a more custom fit earplug.
Thank you. Howard has some great questions. Howard, I think the specificity you're asking might be better answered in a one-on-one consultation. However, Diana, could you briefly discuss the differences between um, loud noise sensitivity for someone who has a hearing loss versus loud noise sensitivity for someone who has very good hearing?
That is a great question. So I think perhaps what that question is pointing to is more the issue of, or could be the issue of recruitment. And so when somebody experiences a hearing loss, um, their threshold for what is barely audible to them compared to the threshold for what sounds uncomfortably loud is a very short range. So we call it a dynamic range. And so sounds can actually grow rather quickly between that threshold for sound to that uncomfortable listening sound. So it does present differently versus somebody who has more clinically normal hearing. And so their dynamic range is much broader, except, there's with the person who experiences hearing loss, typically recruitment occurs due to different changes within the cochlea. And so while the interpretation of it is still the same, there are two different mechanisms that are at play. One being more of a cochlear loss that's lending to the hypersensitivity, and one being more of within the central auditory pathways that is causing the hypersensitivity.
Excellent. So, Dr. Dana, where can patients find you if they want to work with you for their hyperacusis treatment? How could they get in touch? I'll be including a link here for those who wanted to. Yeah, how could they get in touch with you? What could they expect if they wanted to work with you via telehealth?
Sure, of course. So you can always visit our website, and we can connect that way. Certainly, you can find me on LinkedIn as well under same name, Diana Vetere, and we could always set up a call through Treble Health that way as well. But with me, it's a lot of it is just making sure I have a really um, so important to me to understand the functional impact that this is having on somebody. We all want to live our best lives. We all want to live the lives that we want. And so, really making sure that I understand how this is impacting you, setting goals, and working towards those goals. That is really the way that I work through this program, and just providing as much support and as much information. I think knowledge is power. So, the more information you have, the better prepared you feel. And that is our focus.
All right, guys, we're going to share our screen right now and showcase the option to schedule a free consultation here with Dr. Diana and with our team. And then also, I'm going to do a quick review of the schedule. So, the summit here, we have many more speakers that I want you to really consider. If you do have a cell phone and you wanted to scan this code, you're welcome to scan this code. Also, we'll include in the chat right here. the link to schedule your free consult. And this is a telehealth consultation, complimentary. It's available for you who are here for the summit. And then also, we have just completed our third session here. We're going to have a 1 hour break, and then we're going to come back for brain plasticity and tinnitus with an ENT doctor who completed his residency at Stanford and who was trained at UCSF and who worked as a practicing ENT at Kaiser in California for many years. So that's going to be excellent. Join us back at 4 p.m. Eastern. That's 1 p.m. Pacific. And then we have some excellent discussions coming up on topics like bimodal stimulation for tinnitus relief. We're going to have a live fundraiser to benefit the charity that we really support, which is called the American Tinnitus Association. And we'll be discussing CBT for insomnia, a sleep protocol for tinnitus, 25 years of tinnitus retraining therapy with one of Dr. Jastroboff's top mentors, TMJ, and then I'll be discussing what we've seen with over 1,000 patients working at Treble Health. So let's take an hour break right now, and we'll see you back at 4 p.m. Eastern. It's the same Zoom link. All this will be recorded. It's on our YouTube channel. If you wanted to go back and watch it right now, you can actually do that. It's on our YouTube under live video. You can watch it right now. So let's give a virtual round of applause to Dr. Diana. Thank you so much. And we're going to see you guys later. I'll leave this up on the screen for another minute. I advise you to schedule a free consultation. If you're within the United States, this is available for you. And if you're outside of the US, do you need help? Just send us an email, contact@treblehealth.com. Dr. Diana, thanks so much. We'll talk to you soon. Bye, guys. See you in an hour.